Hey everyone, and welcome to This Explainer. Today, we're bringing the energy of a bustling medical college classroom straight to you. We're going to explore a really fascinating topic, what it truly means to be smart in a clinical setting. Because, let's be honest, you've probably noticed that textbook brilliance doesn't always translate perfectly to the real world, right? Well, let's dive into exactly why that is.
It's kind of wild. Why do the absolute smartest students, the ones acing every single written exam, suddenly totally freeze up when a real live patient looks at them and says, "I cannot stand"? It's a classic clinical paradox. You can have perfect textbook knowledge of anatomy and radiographic positioning, but when you're faced with the unpredictable human element, that academic knowledge just isn't quite enough on its own.
So here's our game plan for today to help bridge that gap between classroom brilliance and clinical mastery. First, we'll define traditional intelligence and IQ. Second, we'll broaden that definition by looking at multiple intelligences. Third, we're going to unpack the real secret weapon, the 5 components of emotional intelligence, or EQ. And finally, we'll wrap up with actionable steps you can use to actually improve your EQ.
All right, part 1, defining intelligence and IQ.
Fundamentally, intelligence is basically your ability to think, learn, reason, understand, and adapt to new situations. It's how you use your knowledge and skills effectively in everyday life. It's the engine that helps you solve problems, like, say, a radiography student figuring out how to adjust exposure factors after a blurry image, make smart decisions, and actually learn from your daily experiences.
But how do we actually measure that brain power? Well, that's where IQ, or intelligence quotient, comes in. It's a numerical score used to measure a person's level of intelligence compared to others, with the average usually sitting right around 100. This whole concept goes back to folks like Alfred Binet, who developed early tests to assess mental abilities like attention and memory, rather than just quizzing people on learned facts. Generally speaking, higher IQ scores suggest stronger reasoning and problem-solving skills.
Now, intelligence isn't just one static, unchangeable thing. Think of it like a two-part system. First, you've got fluid intelligence. This is your mental agility, processing new info, learning, and solving problems on the fly. You can actually boost this by challenging yourself, mixing up your routine, or thinking outside the box. Then you've got crystallized intelligence. This is your mental library, all that stored knowledge you've accumulated over the years. You improve this one by reading books, taking classes, or learning a new language. Both work together, and both are equally important.
Moving right along to part 2, broadening the definition with multiple intelligences. Because, let's be real, being smart is way more than just being a math whiz. Howard Gardner's theory shows us there are multiple ways to be intelligent. You might have strong visual spatial intelligence, which is absolutely vital for visualizing 3D anatomy on a 2D X-ray. You might lean into logical intelligence for complex problem solving. Bodily kinesthetic intelligence involves your physical coordination, literally essential when you're physically positioning a patient or maneuvering heavy hospital equipment. And of course, there's interpersonal intelligence, which is all about how well you interact and connect with others.
Oh, and Gardner's theory also includes musical intelligence. And, just to inject a little hospital college humor here, some students definitely tap into their musical intelligence, especially during those brutally difficult exams when they suddenly start singing, "Jehovah help me." Okay, jokes aside, the core takeaway here is that human capabilities are incredibly vast and varied.
Which brings us to part 3, the 5 components of emotional intelligence, or EQ.
The very first component is self-awareness. This is the absolute bedrock of EQ. It is the ability to recognize and truly understand your own emotions, your thoughts, your strengths, and yes, your weaknesses. You have to understand how your own emotions are affecting your behavior before you can even begin to manage anything else.
So in a clinical setting, self-awareness looks like recognizing, wow, I am highly stressed right now before this major exam, or taking a genuine inventory of your clinical strengths. When you actually stop and recognize that stress, you can manage it. This builds your confidence and significantly sharpens your decision-making.
Next up is the second component, self-regulation. If self-awareness is recognizing the emotion, self-regulation is steering the ship. It's your ability to control your emotions, your behaviors, and your reactions across all sorts of different and often chaotic situations.
Let's picture how this plays out on the ward. Self-regulation is remaining perfectly calm when you are dealing with a really difficult or uncooperative patient. It means biting your tongue and avoiding anger during a disagreement. Keeping your cool like that, it promotes professionalism, neutralizes conflict, and helps you maintain your balance when the hospital gets overwhelmingly busy.
Component number 3 is empathy. This is the vital bridge that connects you to the emotional states of everyone around you. It is the ability to truly understand and share the feelings of others, literally, putting yourself in their shoes.
Empathy in action looks like taking a moment to comfort an incredibly anxious patient right before a scary medical procedure. Or it could just be understanding why your classmate is totally stressed out during exam week. Empathy has this incredible power to improve communication, strengthen relationships, and encourage genuinely compassionate patient care.
All right, the fourth component is motivation. This is your inner fire. It can be intrinsic, meaning you're driven by your own personal satisfaction and pride, or it can be extrinsic, driven by external rewards or recognition. Either way, it's what encourages you to crush your goals and keep pushing forward despite major challenges. Clinically speaking, motivation is the sheer grit it takes to practice your ultrasound scanning skills over and over again until you get it right. It's that inner push to study hard late into the night because you genuinely want to become a highly skilled radiographer. It boosts your productivity and fuels the persistence needed to master complex medical tech.
And the fifth and final piece of the EQ puzzle, social skills. These are the abilities you use to communicate, interact, and build rock-solid relationships with other people. It essentially takes all the other internal EQ components and pulls them together into outward action.
Because let's face it, no medical professional works in a vacuum. Social skills are absolutely critical for effective teamwork in a hospital. We're talking about crystal clear communication during life or death emergencies. Having strong social skills means fewer misunderstandings and vastly improved leadership and cooperation among the entire healthcare team.
All right, final section, part 4. Actionable steps for improving your EQ.
So how do we actually build these emotional muscles? Here are 3 concrete steps you can take starting today. Step 1, listen. And I mean really listen. Pay attention to what people are telling you verbally and, crucially, non-verbally, through their body language. Step 2, empathize. Actively practice putting yourself in your patient's or your colleague's shoes to grasp their perspective. And step 3, reflect. Take a step back and honestly assess how your own emotions are influencing your decisions and behaviors.
So let me ask you, after covering all of this ground, why is emotional intelligence so absolutely crucial in a field like radiography, which relies so heavily on technology? The answer is pretty simple. Because the most advanced technology in the world doesn't cure human anxiety. EQ does. It leads to better patient care, stronger teamwork, clearer communication, and significantly calmer patients. I want to leave you with this incredibly powerful thought from the source material. Patients do not care how much you know, but how much you care. It is so true. A truly great professional isn't just someone who crushes academic tests. They know how to handle stress, collaborate, and treat human beings with dignity. Clinical mastery requires both an impressive intellect and an amazing bedside manner. So the next time you step into the clinic, ask yourself, are you just treating a diagnosis, or are you truly connecting with a human being? Something to think about. Thanks for joining us for this explainer, and we will see you next time when we dive into the fascinating mechanics of memory.